My name is Linda Vianda. I've experienced carpal tunnel for about 3 years now from typing a lot, and I'm also a teacher, so I'm constantly grading. So I felt the pain. I'm left-handed, so I felt the pain stronger on my left. And over the years, I've also gotten it on my right.
So both sides?
Both sides,
Okay.
yes. And when I went to the doctor to get treated, I mean, they just kind of gave me some exercises or stretches to do, and then some medicine for the swelling, but that's about it.
Right. That's the, okay. Let's see. Do you see anything here?
The color.
Yeah?
Yeah, throughout the whole hand, yeah. It's also cold.
Yeah. And this one? It's a little better, right?
A little better,
Compared to, compared to left and right? Right side is yang, so it's more energy, no matter what. Left side is yin. And what is it, this indicating?
Stomach, large intestine problem or digestive problems,
Yeah.
cold.
So when I see this, the first question I ask, do you have constipation?
No.
No, you have bowel movement every day? You feel
more or less.
refreshed, you more or less? But there is some stagnation right there.
No.
Okay, this is large intestine area, and this is the lung. Lung 7 is a low point. It's spread to exactly right here. So there's also eminent doctor from mainland China, but he has some modern thought. His thinking process. He confused. He said he could never understand why the large intestines could reflect, has any connection with lung. So he questioned about this. But actually this is low point. And this is all the constipation issue, even that you think it
I don't.
You don't.
I do.
But you do.
Yeah.
But you still do. There's okay, look at your tongue.
Check it out.
Stick it out. Yeah. See, also it's a lot of redness. Are you a sweet eater?
More
Craving?
or less.
More or less. Yeah. And sometimes swollen here that were indicating the heart, because this part is heart, right? This part is heart. The edge is liver, right? So this heart area is okay. Thank you. Sometimes indicating, if it's even some people purplish, you know there's severe insomnia issue.
Do you ever have the pain going up your arm to your neck?
Sometimes.
Onto your neck, okay. So we will have to scrape her to see. The left side is worse, right? You're left-handed, so shift it over.
Because the door, it's tilted.
Right. Should I lie down or?
No, I'm sorry.
just-
You sit down.
Okay.
Here. You sit down here. Just use your back facing the camera, so we could see more. We will see what's common and what's not, compared to what we have already. Okay, in the paper towel. And see if I could roll this. Okay. Is this okay?
Yeah.
Yeah. Because you're not just exposed to me and the whole audience from the world. Thank you for coming, though.
Thank you.
Now, left-handed. So we started with here, left side. Again, I use coconut oil. And neck also related. So we give it a good rub first. And we will see something we talked about earlier. Are you okay?
Yes.
You can complain, okay? If it's too much or too strong and you don't want to take it. So you see, neck is involved, yes. It shows up.
That hurts.
Okay, actually, right side is pretty bad too. It's not pretty bad, it's there. There are some issues. And
So have you been using your right side a little bit more to offset the left side pain?
I think, and
See
then
that
just
way
with
my-
I'm on a laptop,
Yeah.
so the constant of the mouse, or not having the mouse.
Instead of the left, you're doing the right now.
Yeah.
It's definitely an information. I still can't, figure what kind of nature is that. Mechanical is So you can see that's right, and it's more than that. It's right in the center. It's already a little bit purplish. So, and there's definitely a lump here. So right. So if we don't take care of this, the needle will be 10 times. Again, it's for business sake that you don't do this. Keep telling them to come back. We don't do that. We deal with the issue. See this? Sorry. Sorry.
It's okay.
So that's yeah. How's your stomach?
In terms of,
do you feel bloated
yeah,
after you eat?
yes.
Yes.
Do you ever get acid reflux?
No.
So it's another lump. There's more than 1, 2, 3 lump.
And you can see it both sides, over here and over here too, as it goes down,
Yeah. Again, if we don't do this, it will take longer time. If we do this, carpal tunnel issue will be much easier to deal with. It is the left side. There's a blood stagnation. See this side. Young lady, you suffer?
Yes.
Well, you're not gonna let I do this, huh?
I know.
But it'll feel good, yeah.
Do you ever have this? Scraping like this?
No.
No? Oh. Some people will freak out.
It just hurts a little.
It just hurts a little bit, yeah. Some people don't like this.
Feels interesting.
And I will assure to you that you will get benefit from doing this.
I trust you.
Thank you.
And you're a teacher also?
Yes.
So do you have to stand in front of a whiteboard and go look up and write stuff there like that?
I don't do it often, but I do.
It's probably painful when you do that, huh? Sometimes?
Yeah.
I'm pointing it.
Yeah, right, almost capital there, huh?
She suffered. She actually did suffer.
Do you use organic coconut oil?
Yes.
The question was, do you use organic coconut oil?
Yes. Coconut oil is a very interesting saturated fat. That's why some people were against it to take, but it's eatable and it will cleanse bowel. So there's very severe case actually because of that cleansing process and the changing the whole body health constitution. So it depends on if you want to do it, and when you do it, you have some good people, knowledge people advise you how to deal with it. Look at this. And lady, your situation compared to, it's even more stagnation there.
You've had this for 3 years, right?
Yes.
Yeah.
Yeah.
And have they given you cortisone shots to, or anything like that?
No.
The doctors, you said? But they've just been addressing your wrist, not anything else, right?
That's it, yeah.
I feel for you for this. I know you suffer, but I don't like that. You know, this kind of a subjective. It's like we're scaring patient as if they're. No, it's good that we're dealing with it now. Yes.
Did you ever feel like you were getting relief when you saw the doctors for 3 years?
Say that again?
Did you ever feel like you were getting relief? You kept going for 3 years? No.
Not really. I mean, they gave me the pills, and it's just
Right.
like, take it when you feel.
Just the pills,
and
yeah.
I do, but then
So not really. It's really something that we have to really think about it.
Right.
That the TCM, in a way, we could offer a lot
Relief.
before we go to emergency. See, they deal with severe issue, yes, with modern technology, this and that, but then healthcare, including the healthcare, that should be not as wasteful.
Well, the common thing is always give a pill and call me later, right?
Mm-hmm.
Yeah, and that doesn't fix things.
I'll hold a mic for you. I have a question.
Full color everywhere.
So,
Not just left side,
can I ask a question?
please.
In this case, would you use bloodletting with cups? Would that be easier?
Good point. Yes, that could be used. Yes. See, it's the difference between the scraping is this goes more detail, in a way. Cup suction will show you here and there, and even very severe case, we will do moving cup. You know, moving cup. If we have a chance, we can perform it a little bit, but it's quite painful. Not everybody could take it. And now the question about bloodletting, sometimes when I see the lump like this,
Yeah.
and I will pick up the most severe one and let some blood out. Especially when it's closer to, we call UB43 area. Gao Huang Xue, we could talk about it, use it as a seminar. Gao Huang Xue is such an issue spot. Last time we stopped right there, we used that model and pointed to Gao Huang Xue.
But I believe go right along what's happening too.
Yes.
Yes. On both sides.
Do you ever take cup suction before?
No.
Okay. See, this is more or less the area that involved with the carpal tunnel syndrome. So we just want to do it as such. And then I want to place a cup suction. Would that do? Use the one, I bring the one that I have. I want to, because this is a good rim, thick, so it wouldn't be as painful, and good size. It's better than the one, it's actually more powerful than the one that you prepare like this. You know, compared to the one here. This is big. This is, I think maybe because my hand, and I feel comfortable this way, holding it. Okay. This is alcohol. We do it very fast.
Just like a section.
Okay.
We do it like this. Okay.
Just relax.
And then
You should move it.
if we move it, that's very painful. Can you take it?
Yes.
You don't have to, you know. But we have to use a lot of oil because the friction. So I'm gonna let it stay here
Yeah.
because it's probably too much. When we rolled it and we purposely leave, let some air out so it wouldn't be that tight. It's too painful.
Are you done with the question?
I'm done with the gua sha. Yeah. And here's, let's do the big one.
No more alcohol?
Oh,
More alcohol.
this is a weak alcohol. Just a little bit. Okay. Sorry.
帮你点。
Hmm? And 滑.
Oh, this is really slippery.
There you go. You can prepare. Really interesting.
So at least this muscle area could be relaxed. And sometimes, you know, along this area is bumpy like that. And we just let some blood out. But we have more time. We don't have to put everything on here. So when we do cup suction, do it fast. and do it all those muscle area, because this is dealing with muscle. And we place it for the yang side, 10 minutes to 15 minutes. Yin side, about 8 minutes to 10 minutes, no more than 10 minutes. For people, aged people, they taking hormone, estrogen, so their skin very tender. Don't ever go more than 10 minutes because they easily to get blister. Yeah, yeah, it's just give us more trouble. We don't want any possible infections. So I have heard people complain about cup suction from news in Taiwan. That was that they train a lot of students to do the cup suction. Then they leave it more than 20 minutes or so. So that I don't. Then there's problem. Then the blister, then the infection. Then they did not really take care of it and become an issue. So when we want practitioner to be well trained, we know pros and cons, and even that in my own clinical practice, there are times that for that estrogen issue, for the tender skin, still having the blister. So every time when I see that, very alert, so I reduce the time. So pretty much in general, for the back 10 to 12, 15 minutes sometimes for people, it's already too long.
Yes.
And another thing is we did not do the whole back. If we have someone with low back pain, we probably could do the whole back. When that happened, in time we will have a chance to see how we put them cupping in a good pattern. And again from news I see people doing a cup suction for Hollywood star or something. They cup here and there, and just randomly I was just laughing when I see that. I said, oh, this is not a well-trained practitioner to do the cup suction. They just randomly do. But we follow the muscle lining and then make a good pattern out of it. So do you have any questions? If not, then we can remove it. So
a lot of times I find it very common, but like when you see you start to see these along the trapezius and the scapula. A lot of times I call those little train tracks, because you can feel it as you go along the edge, the boom, 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 just like the train tracks, you know?
yes,
And I try to tell my patient, oh, it should be smooth. And it shouldn't feel like train track, you know? And they go, oh, I feel like, and you can feel that, and every time you touch the train track, oh, tender, you know? And that's where all the red would go, yeah.
again, that's UB43 issue
Yeah.
related, and
Right.
UB43 is 高荒嘛, 高荒嘛, right? 高荒, there is a phrase in Chinese that say 病入膏肓嘛. That means very severe. So when there is the 膏肓issue, always severe. And think of this. This is the edge like a corner of our ceiling. And this is between the three major organs, lung, stomach, and heart. So the problem here, some people will have issues and they could develop into even anxiety, depression, panic attack. And they were all thinking that that's a heart issue. So patients always think that's a very severe issue because they have panic attack. So they want big name. Like when they go to the doctor, they think they have heart attack or something. But it's not. It's all stomach and spleen issue, have congested stagnation energy right there. So if we could deal with this, but traditionally, not many points for Gao Huang. I think I mentioned this last time. But in Master Tung's point, opposite side, double sons and fairy, 从子成仙, comes to Gao Huang. Comes to Gao Huang. And then in my clinical practice, there's some other points will help this area. One is navel point. That was inspired in the beginning from navel point, belly button point. It's Kiko Matsumoto's class. I went once, and she talked about every disease is belly button disease, and then, but then she did not elaborate more of the foundation of it. But then I found out there is a very good foundation to ground that claim, and then so belly button point, but we had to find it. And the other one is spleen 4. Then again, we have to find it. So spleen 4, belly button points, and the mesotones point, double suns and fairy, 虫子虫仙, and scraping, and deal with issue right here. And this is, again, a key issue. Okay, thank you.
Do you usually do the cupping and scraping while the patient is sitting up?
Yes. Okay. Now, again, a good question, a technical, clinical practice question. That, yes, especially when sometimes I do cupping back and front. I need this. I need them to expose this, and sitting position will be it. But sometimes it's only the back issue, then they can lie down. It depends on how far we want to cup. Sometimes patient could use up 40 cups, the whole back, all the way down. And then frontal, then we let them change to the front. And sometimes, just cupping enough is enough. I have a lady don't want to get needles, just want to get cup suction. Then I cup her here, then on the side. Then we all have a way to position them to expose those areas. Yeah. Do I answer your question?
Yes.
Good. Okay, right down.
Face up or down?
Face up.
How you feel? Pretty good? Yeah, relax.
We actually do have a choice, just like the other lady, that do correct tendon to clear the muscle line first. Since we're not getting the correct tendons now, I will do 21 to 20 from the up down to clear the whole spine. Do you feel sore at all when I
Yeah.
Yes, here. Exactly on Bai Hui. So she's more or less a young deficient body type.
You feel cold a lot?
Excuse me?
You feel cold?
Yes, all the time. Yes.
Cold
Oh.
extremity.
Everybody.
So that's why we need a good moderator, director
You can
here.
sit on this side.
Okay, again, most of the time, people feel relaxed when this needle especially go this deep. I heard, I never engaged that French doctor. I heard that there's a famous French doctor, needle only the Bai Hui. Only Bai Hui. And he himself said that it took him 10 years to learn this point. I know he knows what he's talking about. You okay?
Yes.
You feel relaxed?
A little bit.
Not Now, you want to feel your wrist?
Still right here.
Right here, okay. Let's go on the lung and the bone.
Yeah, this one's okay.
That one is okay. The left one. Right here.
Yeah.
Let's go for again. Simple. Do you feel sore?
Yes.
Okay. And this, do you feel sore here?
More on this one, but I feel it a little bit on this one.
Yeah. More on this.
More on my right.
More on the left. I have. Right?
Yes.
Now, test here.
It's gone.
It's gone. You sure?
Oh, right here. It doesn't hurt anymore. like that pain I was originally when I told you it's not there. Is it still supposed to be?
The body don't cheat.
Right here, like vaguely.
Okay, that is the one point. Okay.
Is that the spleen line?
Any tenderness here?
Yeah.
A little bit.
A little tenderness right there, huh? Okay.
肾官，肾官。
Okay,
Oh,
can I
oh,
just see this one?
Yes, spleen line, 肾官，肾官。
Right about there? Or here about there, yeah.
Yeah, but not as
Yeah.
much as this one
Okay.
on my left.
Yeah. Okay. So a lot of times when I see carpal tunnel patients, they usually see this right here along the median nerve.
Uh-huh.
That's usually right about there, just slightly above P6 or so, you know. You can almost feel like a little knot right there too.
Treating this side, I'm using, there's another way, we use the opposite
Opposite
side.
side, yeah.
The same, this is synchronized, the energy is synchronized. Therefore, there is a doctor developed points, one, in 1, 2, 3, and yang 1, 2, 3, and leg in 1, 2, 3, yang 1, 2, 3, that's all.
Yeah.
That's all her needle. PC6 like.
PC6 superficial.
Yeah, superficial. So now, you move that.
Hello, yeah. Good, huh?
Yeah.
Did it help?
Yes.
You see a lot of veins. These are all candidate. We call it pathological vein. These are lower mine. These are low junction vessel. So they are from the text from the classic. It describes junction vessels have to go through a very tight area to connect to. It's like a freeway junction. So it actually is harder to go through. So when we do the bloodletting, because it stops somewhere, so that's why we let the blood flow by itself. We don't interfere it because it will strain the blood. So there's leave room for the blood vessel to come again to create a circulation.
Circulation, yeah.
Same idea. Classic book talk about stomach and intestine. That's why I always ask people about constipation, bowel movement. Only that they could get rid of the feces right here, and then the stomach has to create room for the circulation. Same thing. The reason we do bloodletting is for that purpose.
Can I ask a question? Is that point Xinling?
Xinling?
PC6.
Yeah. Don't.
It's the same. Okay.
Don't because you name it, it's just every green and the lighter green in between. There's always another in between shape.
Okay, I see. Yeah.
So every point in between points, there's always a next point next to it. That's why.
Like a half a shot either side, right?
Yeah, and the way that why I like to trace it or like to make sure where the real inflammation is, and then make the corresponding points to needle right there to get the effectiveness.
Yeah.
It's also red sword right there. Let's see how many points we have already. Yeah. We can go for one more.
Yeah.
Tung.
Doing good? See? Yeah.
We have 1, 2, 3, right?
Mhm.
So we go for, hey, tell me, this one?
Yes.
Four? This is A, and this is B, which one more?
I think A.
Oh, A more, so it is the joint issue. I think this needle gauge 32, so it's thinner, so it's not as painful. I usually use gauge 30. We were checking her UB43. Now I'm gonna check your navel here. That, you okay?
Yes.
Okay. This is another area that we could treat for the Gao Huang. But usually we call this 12 o'clock. There's a scar.
I used to have a belly button piercing.
Oh, okay. Is it sore? Sore?
I feel like the pressure.
But there's no like annoying.
No.
Painful. Okay, okay. This is one. This 12 o'clock, I usually go around it. Any place that you feel discomfort. Okay, a little bit here.
Right there.
A little bit right here, right? Yeah. It's about 2, okay, it's even more here, 4 o'clock. Not bad.
Mm.
Okay.
Right there.
Yeah, yeah, right here.
Yeah.
This A, B, and C, this one seems to be more annoying.
Yeah.
Okay. Not as.
Oh.
Not as. Yeah. This is about 8 o'clock. Right?
Yeah.
8 o'clock here. 8 o'clock is her point. This is your stress point. One more. 长.
And what is that one for?
I tell you. I just said the navel point, circle around it. It also could take care of the Shen, the Gao Huang point. And assume if the problem is here, the point is correlating point is supposed to be this one. Supposed to be this one. But instead, it was just opposite of it.
Just a little lateral, yeah.
Yeah. The reason is that yin and yang is moving all the time. So when the first trigger that area, could be nighttime, could be after dinner or something, that it is very interesting. So either right here, that could be an issue, or right here.
I'll do it.
And to relax the point right here, she's fine. When I needle it, doesn't seem to bother her. Sometimes people feel very sensitive, and even pressing, they feel uncomfortable. So we have to relax this area first. And the point to relax this area is spling 9. Okay, that is spling 9. So we could sometimes. Now we don't need it. Yeah, 现在不用，因为 because I already have no problem needling it going downwards and be able to go down. And this one is because it's traumatic points. So when people have trauma or any accidents, it would tighten up right here. So this traumatic point here could relax your trauma. And clinically, some people, once we needle it, they tear up, start to tell the stories. That could happen too. I think I mentioned that before.
The webinar attendees are asking, why did you use Shenguan to treat the carpal tunnel?
Because it's a joint related as well. When she pointed that her pain, she pointed right here. There is a bone issue here. And again, all the points at even carpal tunnel, tendons or muscles or bone level. Bone level is the deepest. Tendons then in the medium, and the muscle level is less. So Shen Guan is for all joints. We will do it anyway. Yes. And then this is for the opposite of this side, because when she talk about the pain is on the pericardium meridian. So for whole body joint issue, we will pick up Shen Guan. But if for whole body tendons issue, we will do gallbladder 34, because that would deal with the whole body tendons. That's the primary point. Secondary point is long 9, long 5. That's a tendons point too. Depends on, which specific area we want to deal with.